Caregiver Respite. Thank you. Good afternoon. My name is Tina Burrell, and I use she, her pronouns. And I'm honored to do an update on Caregiver Respite. I'm going to do a bit of historical context and then a point in time update. First slide or next slide. So Washington State did have respite services for a number of years under a Medicaid waiver, and that came to an end in 2012. Currently, respite is only available through state or local funding. However, in 2017, FISPERTS, our Youth and Family System Roundtable, Family, Youth and System and Partner Roundtables recommended a need for respite based on feedback from youth, families, and stakeholders that this service was missing in our continuum, and they were feeling the need for that. This recommendation came forward for behavioral health respite for youth to meet the needs for our most complex youth in Washington State. They took this recommendation forward to the Children's Behavioral Health Work Group, presented it there, and that work group also supported it and moved it forward as a legislative request and recommendation. In 2021, Healthcare Authority received a proviso based on this request, directing us to create a report that reviewed Medicaid authorities on how we could fund respite services in Washington State. That report was completed in June of 2022, and that was the end of the legislative mandate, was to complete that report. However, HCA wanted to continue forward. Our leadership at Healthcare Authority looked at the various options, and one of them identified was the 1115 Medicaid waiver, known in Healthcare Authority as the Medicaid Transformation Project. And it so happened that we were in the process of renewing this application, which only opens up every 5 years. So we added, they had been working on this application, but we added the request for respite services. I will note it did go for behavioral health respite for youth to caregiver respite. And that strategy was, because it was a little late putting it into the application, and also California had just had theirs approved for caregiver respite. So we moved that forward, which encompasses what we currently have allowable for respite. And the benefit from that is it is lifespan and not just for youth. So I want to shout out to our FISPERTS for helping move this forward. Next slide. So this slide and the next one are really a visual graphic, and I'm not going to go through all of these items. That is under the MTP project, the Medicaid Transformation Project. All of this work is allowable under the waiver and moving forward. In the middle of this graph, you'll see some golden boxes there, and these are the health-related social needs services, and that is the category, the HRSN services, that caregiver respite falls under. There's also 9 other services in that category. You also see Native Hub and Community Hubs, and I'll talk about that a little later. Also want to highlight all of the MTP programs support Apple Health Medicaid enrollees. Next slide. So this is another slide to show sort of the menu of services that are in the health-related social needs services. There are 9 other ones, not going to go through those, but 9 other ones that are on the menu in addition to caregiver respite. Next slide. So for caregiver respite, CMS has provided a definition that's on the screen, and I'll read that for you. Intermittent temporary supervision provided on a short-term basis in the enrollee's home, a healthcare facility, or an adult day center. Services provided to the enrollee are primarily non-medical and may include attending to the enrollee's basic self-help needs and other activities of daily living, ordinarily performed by a caregiver. So this is giving respite relief to the enrollee's caregiver. To qualify for this, and this is broad, enrollees who live in the community and are compromised in their activities of daily living and/or have been assessed to have a behavioral health need and whose unpaid caregivers require relief to avoid an enrollee being placed in an institution, or my preference, a higher level of care. But again, this is what was approved by CMS. Under development are all the mechanisms to get this service out, which includes the delivery service options, the coverage criteria So is who is going to receive the services, what are the services, allowable providers, credentialing, and cost effectiveness. So all of these items, though, has been approved by CMS, we need to have a sort of full package that meets medical appropriateness and evaluation again by CMS. Next slide. So to roll this out, there are two pathways. We will have a fee-for-service pathway and a managed care pathway. And the fee-for-service, the fee-for-service is going to go through the hubs that I mentioned earlier. There'll be one native hub and 9 community hubs, and they'll be contracted to hold the menu of services. In the managed care side, they will run through the managed care organizations and contracts in a lieu of service process. And in lieu of service allows Medicaid managed care plans to pay for alternative services instead of standard Medicaid benefits when it's medically appropriate and cost effective to do so. And so we're going to use a combination of the waiver authority for fee-for-service and in lieu of services for managed care. The long-term goal is to move perhaps an estate plan and continue to use in lieu of services for long-term sustainability. Right now, and this is the point in time update, the only established deadline or anticipated timeline for this work is to launch the hubs, the native hub and the 9 community hubs by July of 2024. They'll be the contract holders, and once those are established, they'll identify deadlines for phasing in and implementing the other services for the HRSN services. And the lead for this work is the Healthcare Authority MTP team.